Hello, I'm Dr. Vicki Hayes with the Maine Health Maine Medical Center Department of Family Medicine and a Master Educator in MITE. In the first half of this video, I will be talking about presentation skills that can be applied to any didactic session to enhance its effectiveness. In the second half, my co-presenter, Isaac Stickney, curriculum designer, will be talking more about specifics of presentation design. Our objectives for this module are to recognize the elements of effective presentation creation and design, to summarize how to deliver an effective presentation, and to construct presentation slides based on the principles learned. The first step to giving great presentations is reflecting on what you're already great at and what you could do to improve in the future. Consider a presentation design such as that incorporated into TED Talks. Why are they effective? Because the speaker is knowledgeable and passionate. They use relatable stories, often incorporating an emotionally charged event, rely heavily on visuals, and they are of a length that supports most adult learners' attention span, which is around 18 to 20 minutes. And the presenters practice often hundreds of times before delivering their presentations. Let's think about composing your presentation. Where to start? Components usually include the content, goals and objectives, audience characteristics, the best design platform, the actual delivery, and incorporating audience engagement. All are important. Most lecturers start with the objectives or the content, but it might be nice to switch it up and consider starting with the audience or the platform. What is the makeup of the audience? What is the level of the learners? And what do they want or need to know? What do they already know? How can I get everyone on the same page, such as including a brief anatomy or physiology component to build on a scaffolding of knowledge? I recommend starting at the end. Think about the 3 things you really want your audience to take away and work backwards from there. All the content should be supporting and leading to these takeaway points. Tell the audience what you're going to teach them. That's the objectives. Teach them the content. Then tell them what you taught them, your summary. This kind of reinforcement and repetition really helps support retention. Give some consideration to the platform you're going to use. Perhaps instead of dumping content into a PowerPoint template, consider Kahoot or Prezi or a Chalk Talk. PowerPoint is a wonderful tool when used correctly, but headings and text-heavy bullets are not the best way to learn. Abiding by the 1-6-6 rule can be helpful. 1 main idea per slide, avoiding more than 6 lines per slide, with 6 or fewer words per line. And please, when using PowerPoint, avoid reading the content word for word from the slides. Your audience cannot listen to you and read at the same time, so often content is completely lost in the translation. So step 1 in our recommendations was considering what you do well. Step 2 is improving in the future. Here is a list to help you of 39 ways to engage your audience. They are organized into openers for the beginning of your presentation, ways to solicit questions from the audience, ways to pose questions to the audience, use of activities and small group exercises, and quick ways to get or get back your audience's attention. An effortless way to engage the audience is simply to build in a question. What do you think are next steps? What do you think the diagnosis is? What are the treatment options? What else do you want to know, etc., before revealing the answer or your slide content. I challenge you to commit to trying 1 or 2 of these in your next presentation. And don't forget your personal impact. A dynamic speaker helps to reinforce their words and support audience retention with their body movements and voice inflection. Consider your posture. Is it open with no slouching or folded arms? Pay attention to your use of gestures. Are they intentional and deliberate or distracting? What do you do with your hands when you speak? Consider your attire. Muted colors and modest accessories keep the focus on your talk and not on your clothing or jewelry. Hopefully these tips on presentation skills will help you on your way to becoming an even more fabulous presenter. Now Isaac is going to talk to you about presentation design.
Hi everyone, I'm Isaac Stickney, a curriculum designer in the Maine Health Department of Medical Education. Today we're focusing on key presentation design principles that help minimize cognitive load and keep your audience engaged. After the video, be sure to check out the learning materials in this module. They include Maine Health and Tufts branding guides, plus tools for fonts, colors, icons, images, and more to help you put these principles into practice. Visual hierarchy arranges elements to show importance and guide your audience's eye. Make take-home messages pop with bigger size, bold style, or contrast. Always ask, am I using hierarchy to emphasize a learning objective? Design for that first. Less is more. Use plenty of white space so your audience isn't overwhelmed and can focus on you instead of the slide. Keep everything aligned neatly and repeat the same styles throughout to make your slides feel consistent and calm. Quick tip, line everything up so nothing looks random. Titles, bullets, images, or icons. When items line up neatly on the left, right, or top, the slide instantly looks cleaner and easier to read. Use sans serif fonts size 30 or higher for readability. Keep fonts simple, 1 or 2 families. Quick tip, take a look at your slides from the back of the room. Readable from afar? Good to go. Keep colors simple. Use 3 to 4 on the same palette. Vibrant for playful, darker for professional. 1 primary plus neutrals work best. Quick tip, use the Maine Health or Tufts color palettes to generate harmonious schemes fast. Use visuals to focus attention and reinforce concepts. Large, aligned, in one consistent theme. Avoid noisy backgrounds. Keep it polished. Ask yourself, does this image clearly explain or support what I'm saying right now? If not, replace it with something more relevant. Choose high-resolution visuals and limit to 1 key image or a small set of icons per slide so nothing competes for attention. Your audience should grasp the point instantly. Quick tip, for icons, check the Infography document in this module or the icon section in Maine Health's branding guide for consistent professional options that match our style. Transitions and multimedia, use them sparingly. Most slides need none at all to avoid distraction. Videos are especially good for demos, like showing a procedure, technique, or dynamic process that's hard to explain with static images alone. They add engagement and help retention when used right. Add multimedia only when it truly matters, like emphasizing a key point or changing pace, and always practice and test everything beforehand so it runs smoothly. Quick tip, for transitions, limit to 1 or 2 subtle styles max. A simple fade beats flashy spins every time. For videos, keep them short, 30 to 90 seconds is ideal, and embed them directly into your slides. Plan content and key messages first, pick color and typography, collect images, then design layouts. Master these 4 core principles. Contrast, make elements stand out and create visual interest. Repetition, build consistency across your slides. Alignment, keep everything neatly lined up for a clean, organized look. And proximity, group related items so your audience intuitively understands connections. Quick tip, aim to follow the 10-20-30 rule. No more than 10 slides total, keep your presentation to 20 minutes or less, and use no font smaller than 30 points.